Hey everybody, it's Matt Shu from Upright Health, and today I wanted to talk with you about a book that I just read that I'm really excited about. It's a book by an orthopedic surgeon by the name of Ian Harris, and the book is called Surgery: The Ultimate Placebo. It's a spectacularly good book to read if you're thinking about how surgery became such a popular intervention for so many different pain issues. And basically he lays out the foundations of basically how different surgeries become popular and shows you many examples of surgeries that became really popular based on a plausible biological explanation and then very low quality in terms of science, very low quality observational studies that were really heavily biased by who was doing the studies. Well, who was doing the studies that could be so biased in their observations? Well, that would be the surgeons who were performing the new surgeries that they thought were really effective. So in this book, Ian Harris talks about how many surgeries basically start off with the same path that I have been talking about with surgery for FAI. Essentially, somebody has an idea that, there's a biologically plausible idea, like, oh, maybe this anatomical thing is causing a problem, and if we remove this anatomical thing, maybe that will fix the problem. And so you do the treatment, you do the surgery, and then you find that it is effective based on whatever metrics you happen to be using as the surgeon. Sometimes you're using good metrics, but as this author Ian Harris notes, many times they're using metrics that actually don't align with what the patient would consider successful. So, for example, is the anatomical offending piece removed? That might be considered successful by the surgeon, but in the patient's eyes, it's not successful unless the pain is actually removed. And there are many instances of this that I've mentioned before with surgery for the hip, where the outcome of the measurement for a successful outcome is defined one way by the surgeon, but really when you look at it from a human being's perspective, that score or that metric that's being used to measure success actually really doesn't mean anything. It doesn't correlate to somebody feeling better or being happier about how things turned out. So this book, it's a pretty quick read. I read it in one night. It's a pretty short book. You can get it on Amazon Kindle. I would definitely highly recommend it. It goes through the history of many different surgeries and explains where all the scientific shortcomings are in dealing with surgery and dealing with pain. And it's really good food for thought for anybody who's thinking about surgery and thinking about how surgery became such a huge piece of the treatment puzzle. It was really eye-opening for me to read, and it was especially eye-opening to read because it's written by an orthopedic surgeon who really is on the inside of that industry and is really being extremely honest in stating what I think many people have suspected for a while. So anyway, I just wanted to talk about that book real quick, tell you about it, and hopefully you'll go out and read it. And hopefully it gives you some ideas, gives you some insight, and hopefully you remember that pain sucks, life shouldn't.